Homelessness is worsening over time.
If you don't have a home, you really can't focus on other parts of your life.
Our children are our future because we are the present.
You're one really bad day away from being homeless.
Folks that you walk past on the street, they're somebody's family member.
Housing, education, people. Those are game changers. We have the money, the intellect, the passion. We can do this.
Hi, my name is Hannon, and I'm the host of The Bells I Hear, an audio and video podcast that aims to raise awareness about the homelessness crisis in New York City and the complexity surrounding the issue. Thanks so much for tuning in.
Follow us on social media at The Bells I Hear, and email us your stories and questions at thebellsihear@mentorapromise.org. Check out the description of this podcast or video for more details. And now on with the show.
Today we have Gary P. Jenkins joining us. He previously served as Commissioner of the New York City Department of Social Services. He now serves as Chief Administrative Officer at Urban Pathways, a nonprofit dedicated to providing housing and support to those in need. Hi, Gary. It is a pleasure to have you on today.
Hi, Hannah. Thanks for having me. I'm excited to be here today.
Just to get us started, we'd love to hear about your journey. How did you get from, point A in your career to up until this point?
Sure. So I started in government almost 36 years ago. Can you believe it or not? I was in the Department of Social Services. I started out as a house parent, and that was the frontline level. And I gradually moved up into an eligibility specialist where we interviewed individuals for public assistance. Then I worked in the Medicaid program, which is our public health insurance program here in New York City. I worked in the child support program. I worked in what we call the Family Independence Administration, where that is all of our public benefit programs, such as cash assistance, SNAP, formerly known as food stamps, Medicaid. And then I, just kept moving up within the organization. I've always had a passion to give back to others. Just to give a little background on my journey, I'm the youngest of 8 kids, grew up in Brooklyn, New York, a single parent household. My mom raised all 8 of her kids, primarily by herself. We grew up on public assistance. We lived in a shelter for a little over a year. So I approached this work not just as work. And I told my team when I was in government, like, I don't approach this. This is not a job to me. This is my journey. This means something to me personally because I was part of the system that helped develop me into the man that I am today. So it was really important for folks to understand that, approaching this work, it was personal. It was just not a job where I was earning a salary. Could have went anywhere. Could have went to nonprofits. Could have went to private sector. But I wanted to work in an agency that helped my family get on our feet. It was not easy for my mom raising 8 kids on public assistance, living in the shelter, being marginalized and being felt as we were, being felt that we were a marginalized family. But my mom really kept us close knit and let us know that this is not the end of our journey. Our current circumstances is not the end. And I would never forget a case manager, a caseworker in the location when we went to do recertification told me, Gary, this is not your end, or this is not your end. This is your beginning. Go to college, get an education, and move out of the situation that you're in right now along with your family. And that resonated with me. So I really wanted to go back and give back to those families, those individuals, to remind them that your current circumstance is not your final circumstance.
Wow, that's a beautiful journey. Clearly, there was a personal connection there that sort of, propelled you into this space, which is really amazing that you kind of want to give back and kind of, reinforce to like homeless people at this current state, like this isn't your final destination. Like this is just the starting point. Like this isn't the end. And I find it to be really beautiful. You have mentioned you worked in the public service space for 30 years. And, during that time, you did serve as social services commissioner. And you were, responsible for tackling the city's most complex issues, including homelessness and poverty. Can you tell us about some of the biggest challenges that you faced?
Sure. So when I was appointed the commissioner by Mayor Eric Adams back in 2022, that was a career high for me. Working in government for well over 30 years. And I said before I retired from government, I wanted to be the commissioner of the agency that helped my family get on our feet. So it's not an easy job, but it's a fulfilling job. And we serve folks with care and compassion, understanding that Folks don't want to be in that circumstance. They don't want to receive public assistance. They don't want to be homeless, but they are, and that's the situation that they're in at that point in time. So when I became commissioner, that's when the influx of migrants flooded our city. That was very challenging, not just for my particular agency, but for the city as a whole. To have these New Yorkers come in, traveling across the country to come to a place where they wanted freedom. They wanted to come here and start a new life. But again, for government, it was very challenging for us to have that influx of folks coming in, and we had to handle it, and we had to make sure that these people were housed, that they received food, they received the care, they received the compassion, they received the love that New Yorkers give to new folks who are coming to our city. And we did it, and we did it with care and compassion. Was it easy, Hannon? Absolutely not. I would not sit here and say it was an easy task, but this is what we signed up for. We are public servants. We serve the public, and we serve the public proudly. No matter who you are, where you come from, we wanted to be there, and we were there for those who were in need of our services.
I guess on the flip side of that question, what's maybe a positive impact or something that you felt like, you made a difference or you made a change because you mentioned that, you did want to give back to a system that has helped you and your family. So I guess what kind of positive mark, have you left?
One area that I'm really proud is that we had folks who were homeless come sit at the table at City Hall, and we gave them a voice, and we gave them a platform to help us as we're creating policies to have their input. That was not done previously. And again, I was in government for over 30 years. We did not engage the folks who were directly impacted a seat at the table to say, what can we do better? How can we help you get on your feet? I'm really proud that this administration was afforded the folks who were directly impacted to come to the table and have a seat. What I heard was that for single individuals, they had to be within the shelter, back in the shelter by 10 a.m. And families with children, they had to be in by 9 p.m. I know as a grown man, being inside by 10 every night would be very challenging for me. So we had to meet people where they were. They said they had other obligations. They are citizens just like we are. They are individuals, New Yorkers just like we are. And they have business to take care of just like we do every day. So we extended that time to 11 p.m. for single adults. And then for over the summer months, it was 10 p.m. for families with children. So we were not micromanaging their lives. We gave them the flexibility to move about, take care of their daily responsibilities, and then come back in so that way we can ensure that they had a bed that evening to lay their head, and they had the safety and security of knowing that they can come back to a location where they can temporarily reside. That really resonated. We received a lot of good feedback from the population stating that you actually heard us and you made a change.
You also, recently joined Urban Pathways as inaugural Chief Administrative Officer. What does Urban Pathways do?
I am really excited to be part of the Urban Pathways family under the leadership of CEO Fred Shack. Have an amazing team that serve individuals who are homeless or formerly homeless, have mental health concerns, substance abuse, and we're out there every day. We have outreach teams in the Port Authority, at our local airports, out there engaging individuals, meeting them where they are, letting them know that they can come inside and we can provide services to them with care and compassion. We're also a nonprofit developer. So we have several buildings that we operate and we own and we provide services. And these are affordable housing for individuals where we have on-site services. We're really proud of this because we want folks to know that we are here as a nonprofit to help them get back to a state of independence while providing support services as well. We have our mental health. We have a medical doctor on staff with us. When we are looking at how can we improve mental wellness, how can we help individuals stay healthy. Really proud that over a period of time, We reduced our calls to an emergency room by 50%. And that was just through education, through our medical team, letting them know our population, our clients, our residents, that there's another way. You can stay healthy. Let us educate you on how to be healthy. So just imagine cutting emergency calls, emergency visits by 50%. Urban Pathways is on the right path to do what's right for those individuals who we serve.
That's incredible. There are plenty of organizations out there that are combating homelessness. Why did you choose Urban Pathways? Why did it feel like, the right fit for you and what you wanted to accomplish within your own journey with giving back?
So, as the commissioner for the Department of Social Services, we worked with a lot of nonprofits in this field of homelessness and providing mental health services. Urban Pathways always stood out to me. And I have to give it to the leadership, right? Fred Shack, his heart is in the right place. He's been doing this well over, I believe it's 40 years of just really meeting individuals where they are, putting the client first, being client centered. And I watched Urban Pathways and I watched how they engage their population. So it was a natural fit when I was like, okay, what else? What's next? I retired from government, a proud public servant, was there for 36 years. And I was like, I'm not over it. I still want to be engaged in giving back. So when the opportunity came up and Urban Pathways was looking for their first chief administrative officer, had a conversation with Fred and he was like, do you know of anyone? And I looked at my wife and was like, why would I look outward? This job seems perfect for me to still contribute and be part of a great team. And we have a great team at Urban Pathway. So I'm really happy, Hannah, to be here and to be the first CAO and to work with the team and make an impact.
Yeah, it's amazing. We would love to hear more about impact. Like, what would you say is, the biggest win that you've had at Urban Pathways?
Going on 6 months, when I came in, we were in the process of opening our second drop-in center in Manhattan on Ninth Avenue. And the drop-in centers is where individuals can come from the street. Our outreach teams engage these individuals, let them know that there's a place they can go to receive 3 hot meals, to shower, to receive supportive services, and just to be in the community and meeting them where they are. So it's like you're still in the community that you're comfortable with, but now you have a place to come where you can receive help if you want, right? You can lay your head. And we have chairs. You can rest. You don't have to be in the element if it's extremely cold outside or if it's extremely hot outside. We at Urban Pathways have a drop-in center for you to come in and just take a breath. Take a breath while also knowing that we have and they have the ability to engage our staff and we can do case management. We can connect them with services within the community or beyond to help them get the services that they deserve, not that they need, they deserve these services. And we're there. So our staff are there 24/7. It's open. You can come in, you can leave. There's no restrictions. And we're there and we're available to you. So a big win is when we open that location and really proud of the staff and the services that we provide there.
Urban Pathways is an amazing organization. You have amazing tools. Is it easy to get people to know about it or to hear about it and hear about these amazing services? How do you sort of like maneuver that?
So letting folks know about Urban Pathways and especially our clients, right? Again, I said we have an outreach team, an amazing outreach team that's on the street every day, engaging homeless individuals, right? And I say unhoused individuals, and letting them know that we're here to provide assistance. It may not be the first touch, it may not be the second touch, it may not be the third touch, but we continuously engage our population, letting them know that we're here. If they need socks, right? If they need a jacket, they need some garments that they don't have, we're there and we're telling them that it's available to you. We bring it to them. We meet them where they are. We're kneeling down and actually sitting right next to them, talking about the services that we offer. And again, they may not trust the services that we're providing because they've been through a lot of trauma already. But as we build that confidence, build that rapport, build that relationship, they eventually do come in. And when they come in, it's so satisfying for us because we know now we touch one life. We touch 2 lives. We touch 3 lives. And we're not just touching that individual lives, right? Life. We're touching their families as well because it's impacting their families. These are moms and dads and uncles and aunties and cousins. And honestly, Hannah, these are our next door neighbors. They live next door to us. And they fell on hard times, not because they wanted to. Life happened. And we want to get them back on their feet to where they deserve to be independent again. So it takes a lot of engagement, but we're out there every day advocating on their behalf, having those discussions with them, meeting with our local officials, telling them the services that we provide so we can get the message out.
So I also want to ask you, what do you see as the biggest gaps in New York City's approach to homelessness?
Even outside of New York City, I think we have to look at how homelessness impact our populations, our Black, our Latinx, our indigenous population. That's what's there. That's who it's impacting. And we need to be honest and realistic that it's happening to these marginalized populations. And what can we do better to prevent homelessness? What can we do better to provide services at the start, not while it's already impacted their lives, but the services should be available at the beginning, and folks need to know about it. So if you're having a mental health issue, where can you go? How can you get these services? What can we do as a society to address them?
I do want to follow up on something you just said is like we need folks to know about them. Do you have an idea of how we can approach that question or sort of, problem areas? Like we have all these services and we have all these resources, but how do we get people to know about them and like go to the right place for them or locate them and that sort of thing?
I think it's take collaboration. One of our values in Urban Pathways is collaboration. And I have this pen on, and we have 6 different values, but I chose collaboration because it's extremely important. In order to get something done, you can't do it alone. You have to work with others. We have to work with our city partners. We have to work with our state partners. And yes, we have to work with our federal partners as well, even if they don't believe in what we want to do for our populations. It's going to take a collaborative effort because it's impacting everyone. It's impacting our budget. It's impacting our lives. It's impacting our well-being. So we have to work together. We have to get the message out to let folks know that there are services available. In New York City, the Department of Health and Mental Hygiene, that's an agency that assists individuals with mental health needs. We have our Office of Mental Health. That's at the state level. We have to work with our state partners to say what resources are available and how can we promote the availability of these resources. So when we work with our community-based organizations, they know as well. Folks feel comfortable with our CBOs. Folks feel comfortable with our nonprofits. And when I say folks who need those services. So why not collaborate and build a team to say, hey, if a Gary Jenkins is out there and he's unhoused and he's having a mental health crisis and at the beginning, let him know that these services are available. At Urban Pathways, we do it every day. We're on the streets. We're speaking with individuals. We're letting them know that we're here, we're available to them, and we want to be of service to them.
So how would you say that Urban Pathways sort of like fills in those gaps?
With our population, we're looking at their well-being. We're looking at their mental health. We're engaging them. We're case managers who are wonderful and believe in the work that they're doing. Let our population know, our residents know that we are here to help. And how do we how do we know how we're doing? We conduct surveys with our clients, with our residents to say, how are we doing? What can we do better? And we listen to them, right? We have community meetings. We have our senior leadership. We engage with our residents to say, we want to hear directly from you so we can do better. We have lobby days, right? We have a lobby day coming up on Monday, and we're going to Albany, and we're going to speak with our elected officials and let them know what we believe in on behalf of our clients. We want their voices to be heard. And we also invite our clients to come along with us because they have a voice and it should be heard.
So Housing first initiatives have gained traction in recent years, and even Urban Pathways embraces, a housing first methodology. And, for those of you that are unfamiliar, a housing first approach means that we prioritize providing permanent and stable housing to those experiencing homelessness. What are, some of the key factors that make them successful?
So, as you said, Hannah, at Urban Pathways, we believe in housing first. It's successful because a person needs to know and have a place to lay their head, right? So if you have a place to lay your head, you can address all the other issues that a person is experiencing. So I know if I'm unhoused, I'm not going to be in a stable environment. I want to have my own. I want to know I have a key that I can put in a lock, turn it, go inside, and then deal with life. So we believe in housing first. We believe in wraparound services, right? Supportive services. You have some folks need that extra support. We provide that at Urban Pathways. We give them a house first, an apartment first that they can call their own, and then we provide the additional services that they deserve. So housing first, definitely believe it's been successful. It's proven. It works. Folks say, "Oh, how can you end homelessness?" To me, my response is always an easy response, a simple response. Housing first. Get a person into an apartment. We can deal with everything else afterwards.
You've been working in this space for a very long time. We're kind of wondering, like, if you could change one thing about how homelessness and social services are approached, what would it be and why?
If I can change the perception of homelessness and folks living in poverty, we need to really educate our citizens that a person does not aspire to be unhoused. I said it earlier, an unhoused person is someone's mother, father, brother, sister, aunt, uncle, cousin. And we have to remember also, they were our next door neighbor and they fell down on hard times. So we as a society, we as Americans, how can we help those individuals get back on their feet and stop this preconceived notion that because you're unhoused, it was your choice. It wasn't your choice. Something happened along the way. And how do we, as leaders in this field, as New Yorkers, how do we help these individuals get back to where they were? So I think it's our responsibility. If I can change one thing, as the question was posed to me, I want to change how people view unhoused individuals.
How do you think we can go about, changing people's perception? How can we sort of begin to like unwire this misconception about homelessness being, people's choice, at the end of the day?
Again, it's giving those individuals a voice. Let New Yorkers hear directly from the person that's impacted. And at Urban Pathways, we do that. As I said, when we have our lobby days, when we meet with elected officials, we really want them to hear directly from the impacted individual. And what you hear from them on a daily basis is, I don't want to be in this situation. I'm here. How do I get out? I need help. How do we help them? How do we provide services to them? How do we care for them? How do we love them, Hannah? We need to embrace the individuals. We need to let them know that this is not your end all. I mean, like I said, at one point in time, my family was homeless. If folks around us didn't believe in us, didn't pour into us, I could very well be that person on the street, unhoused. But I'm not. I became the commissioner for the largest Department of Social Services in the nation. I work for an amazing organization, Urban Pathways, which still gives back to those individuals. We have to learn and we have to remember to love one another, to care for one another, to embrace one another, to help a person out of the situation that they're in, that they don't want to be in.
How do you think we can help highlight the issue of homelessness without politicizing it?
Take the politics out. Again, look at who we're serving. Look at who is living in poverty. Look at who's living on the street. And just let your heart speak to it. And not allow politics to enter, but really being person-centered. If you're person-centered, you're going to know that this person is in a situation that they don't want to be in. And when I say we serve individuals and we provide services to those, not because they want our services, but they need our services. So take all the politics out of it and look at the individual, look at the person themselves, and then ask the question, if it was me, would you want help? Would you want assistance? Would you want somebody to care for you? Would you want somebody to expose you to services to bring you out of your predicament? Put yourself in their shoes.
What are some real world solutions that we can, do to help our fellow citizens? Kind of like you were mentioning, these are people just like us. We could very well be in their shoes, right? If you're let go of your job or if you get a medical bill, like that could really, send you into a spiral and that could lead to homelessness potentially. So I guess how can people sort of help in mitigating the issue and helping out their fellow community members that are struggling?
I mean, in New York City, the city has a program called New York City Service. You can volunteer your expertise, your passion. They have different areas where you can incorporate yourself, and they would dispatch you to various nonprofits, city government organizations where you can actually lend a hand. They have local soup kitchens, pantries, nonprofits. Reach out to us and ask, how can we help? We would love at Urban Pathways for folks to say, we would love to go and assist and work out how can we work with unhoused individuals. Offer your services. Be involved. Be an impact on individuals who need your services.
You did mention previously a big misconception about homeless people, which is that they have sort of chosen to be in the situation that they're in. Do you feel like there is like another misconception that you think that we need to dismantle or just like look at from a different perspective?
Unhoused individuals, folks who are living in poverty, they want to work. They want to take care of themselves. They want to be independent. So I think as a society, we should explore what are those opportunities? How do we work with our local community colleges? How do we work with workforce development to provide the skills that they need in order to thrive in society, to get a job, to give back to society? They want to. I hear that every day. We want the resources to put us in a better position so that we can take care of ourselves and we can take care of our families. Again, it goes back to collaboration. How do we collaborate in order to help this impacted population?
Based on what you said, it truly sounds about coming together, working together to just help each other out where we're maybe falling short or need additional assistance. Do you have any final thoughts or words for our audience?
The folks that you walk past on the street, the folks that you see going through a mental health crisis, they're somebody's family member. And they're not in the situation that they want to be in. But as a society, how do we help them? How do we give back? How do we help that individual get back onto a road of stability? Because they don't want to be there. Trust me when I say it. Work with your local elected officials. That's their job. That's what they signed up for, to make sure that they are helping their communities. And they want to help their communities. That's why they ran for office. The local government employees, they are there because they want to be there. They want to give back. They want to help. Our nonprofit organizations who do an amazing job in Urban Pathways, we have an amazing team, frontline staff members, our medical doctor, our chief operating officer, our chief program officer. Everyone is in this because they want to give back and they want to help our population get back on their feet. So I say, you hear my voice, please give back, help. Don't, change your mindset and understand that we have to be in this together in order to make a change.
Thank you so much, Gary. It was a pleasure having you on today. I'm sure our audience is going to take away so much.
Thank you for having me. I really appreciate it. And I appreciate the invitation. And I will come back anytime you invite me.
Thank you again for listening to The Bells I Hear. Subscribe to our podcast and follow Mentor Promise on social media for more. Special thanks to Alice Obar, our video editor, and Berenable Mello, our producer. Song credits to Elegua by Diego Urcola.